on Health and Demography is hereby called to order. On the eve of Human Rights Day, we are reminded that the fight against HIV, TB, and all health conditions is a fight for the rights to health, dignity, and social justice. HIV and TB reveal the same truth. Disease thrives where inequality persists. Each day, TB alone claims 98 Filipino lives, lives that should have been saved. Our principle in the Senate Committee on Health is simple. Bawat buhay, mahalaga at dapat halagahan. No Filipino should be pushed to the margins because of illness, visible or invisible. That is why we advance stronger HIV programs, a decisive NTB strategy, and today, key reforms for autism care. Early diagnosis, inclusive education, community support, and lifelong care. Across HIV, TB, and ASD, one cornerstone remains constant: community-based action. From BHWs leading TB dots, to treatment partners supporting PLHIVs, to families and advocates serving autistic Filipinos, community care holds our system together. This is why we are revisiting the Magna Carta of Barangay Health Workers. It isn't just a labor bill, it is the backbone of universal health care. Without empowered, protected, and fairly compensated BHWs, our reforms remain words on paper. Our agenda today shares one vision: a health system where no one is left behind, where stigma has no place, and where the rights of our healthcare workers are respected, promoted, and protected. Ang layunin, mas makatao, mas inklusibo, at mas makatarungang kalusugan para sa bawat Pilipino. Maraming salamat po. As my fellow senators arrive, I will ask them if they would also like to make opening statements. So could I please now request, in the recent World AIDS Day, we are reminded that the Philippines faces one of the fastest growing HIV epidemics in the region. From July to September 2025 alone, DOH recorded 5,583 new cases, 30% of them under 18. Dito lamang weekend, nabalitaan natin na may isang 7 taong gulang na bata mula sa South Cotabato ang nagpositibo sa HIV. Di umano hindi inborn o mula sa mother-child transmission. And these are young lives facing a lifelong challenge. We have the tools to end AIDS by 2030, but what we need is strong policy action, full implementation of RA 11166, and strategic legislation for a resilient, inclusive, evidence-based response. Progress is real, but service gaps, inequality, and stigma keep young people, women, and other key populations at risk. The message is clear: protect rights, expand access to prevention, testing, and treatment, including new long-acting technologies, and strengthen community-based and primary health care. Support health workers, uphold the dignity of every person living with HIV, and ensure no one is denied care or discriminated against. Let us choose compassion, justice, and inclusion, so no Filipino faces HIV alone. We now invite PNAC, DOH HIV program managers, civil society, including Achieve, community leaders, including Pinoy Plus Foundation, and UNAIDS Philippines, to give a short 3 to 5 minute presentation, assessment of the HIV situation, national response, and priority legislative proposals. So can we hear first from PNAC? Dr. Delia.
Good morning, Madam. Good morning, Madam Chair,
Good morning.
Honorable Chair and members of the committee. Thank you for the opportunity to speak. RA 1166 or the Philippine HIV/AIDS Policy Act made a crucial reform by allowing adolescents aged 15 to below 18 to consent to HIV testing on their own. However, the law is silent on whether the same minors may consent to HIV treatment and other HIV-related services. This creates a serious gap. A young person can learn they are HIV positive, yet may be unable to start life-saving treatment without parental involvement. The Philippine National AIDS Council recommends allowing these minors to access antiretroviral treatment and other HIV services under the supervision of their attending physician, who is in the best position to assess their health status and maturity in availing these services. Clarifying this in legislation or implementing guidelines would ensure continuity of care, prevent harmful delays in treatment, and align our HIV response with child rights principle and clinical best practice. A young person capable of consenting to an HIV test is often equally capable of understanding the need for treatment. Our policy should protect their health by allowing timely and supervised access to care. Thank you.
Thank you, Dr. Delia. Could we hear now from the DOH HIV program managers? Sino pong, yes sir, Dr. Junio.
Good morning po, Madam Chair.
Good morning.
So, for the Department of Health as the program manager, as of October 2025, the current performance in terms of the 95 is at 60%, 64%, and 59%. And as we can see, there's still a gap in terms of our targets of 95. With that, currently the Department of Health, through the National AIDS and STI Prevention Control Program, we are now at the end phase of finalizing our strategic plan, updating of our National Health Sector Plan for HIV, STI, and even viral hepatitis for 2026 to 2030. The last update was 2019 to 2022, and I think it's time for us, due to the current trends and burden of the disease, I think it's time for us to recalibrate our current strategies and interventions, and hopefully this plan can be implemented not only by the Department of Health, but also with the other stakeholders here involved in the response for HIV. So I'll just highlight some of the strategic focus of the current NSP. First is to scale up our service delivery, strengthen our health system, and increase our engagement with private and, of course, our community-based organizations. Our vision is to have zero new infections, zero AIDS-related deaths, and zero stigma and discrimination by 2030, with the goal of reducing mortality, reducing new infections, and zero catastrophic cost. So the cross-cutting principles that we want to highlight should be evidence-based, people-centered. It should be inclusive, multi-sectoral, highlighting the need for innovations, optimization, of course, resilience, and when it comes to different disasters. That's all, and thank you, and good morning.
Thank you, Dr. Junio. Of course, yung 60%, 64%, 59% natin on the 95 targets ay 64% of the 60%, diba? So mga 36% of the total who tested positive, and then 59% lang of those, or I don't know, 15% lang of all who tested positive are actually tawag dito, so low na yung viral load na they're no longer even infectious. Oo, so 85% pa actually yung kailangan nating habulin of those who test. So baka sabi nyo nga, sabi ng department, only 60% actually test. So marami po tayong nahabulin. But thank you for yung vision pa rin of zero infections, new infections, deaths, and stigma by 2030 pa rin po. Sige po, salamat. Could we hear now from Achieve and other civil society organizations. Ms. Amara.
Thank you, Madam Chair. Good morning to everyone in the room. Action for Health Initiatives or Achieve, along with its partners from the Network to Stop AIDS Philippines, has worked along with our Senator Risa Hontiveros to pass RA 11166. We are greatly invested in ensuring that the spirit of this law is implemented properly so that we reach the vision that it has uh, aim to achieve when we pass the law, one of which is ensuring that because the current HIV demographic in the country has seen the rising number of cases among young people, that we make sure children and young people have full access to whatever services that are available for HIV prevention, testing, treatment, and care. We support the call to make sure that while we are able to ensure access to testing of minors, they are still barred from accessing treatment without parental consent. And we support the call of the Philippine National AIDS Council in that way. Two bills have already been filed in the House of Representatives, and we want to see the same to be filed as well in the Senate. Additionally, the role of community organizations have always been critical in ensuring that the most marginalized of those affected by HIV and AIDS are able to access treatment. We have proven that uptake of testing and treatment is fueled as well by community-based efforts like community-based screening and testing, as well as community-led interventions that provide treatment and care. As such, we also want to make sure that communities are able to be part of accountability mechanisms that ensure the law is implemented properly. We would like to put forward a recommendation that institutionalizes community-led monitoring, a system that allows for systematic documentation of barriers to access, experiences of communities in terms of availability, accessibility, acceptability, and quality of healthcare services, and ensure that this data is recognized by government as part of its strategic information to inform decision making for policy, program, and services. With the implementation of community-led monitoring over the past 2 to 3 years, we have already seen how it has helped local government implementers in making better decisions and improving quality of healthcare services in our local service providers. Additionally, this year we have seen the drastic decrease of funding from donors because of decisions from other countries, from the US in particular, that has also affected the decision making of other donors from other countries that have supported the country throughout the years. The donor funding supports prevention efforts for HIV and AIDS, most of which are implemented by civil society and community organizations. With the drastic decrease of funding from donors, we call on government to step up and support community-led interventions through social contracting mechanisms and other forms of partnerships that allow for sharing of resources that can sustain the efforts that are led by communities and civil societies to make sure that we do not lose access of marginalized communities that are able to come forward only with support from their peers. That's all for now, Madam Chair. Thank you so much.
Thank you very much also, Ms. Amara. Alam naman po natin lahat, even beyond the health sector, these days are the season of transparency and accountability, no, in relation to anti-corruption and everything else. So very interesting po yung nire-recommend yung community-led monitoring at saka yung social contracting mechanism. So for one, I'm very interested to learn about those. So sa pagtrabaho natin sa either new bills or amendments to current laws, baka you can share more about that sa technical working group. So tignan natin paano natin pwedeng i-reflect, bigyan ng spasyo sa batas so that there's support for that at the community level. Salamat po. I failed to call earlier. We'll just go back to that after magsalita